strip should come over the bit. Okay? Press here and pull it down. This front elastic should cover all the hair inside. Okay? The cap, mask, two zones. Third one is we need only the diagnostic instrument as well as the working instrument. That is a syringe. First I am taking the diagnostic instrument. I am not wearing any gloves, but I am just stripping it, dropping it. Okay, I am not touching any of the instruments. Now I am not going to do any arrangement. You take the syringe. All what you need, you bring. Okay. Then I'm just without touching. I'm just that's all. Okay. Still we need the adapter for the syringe, topical. If it is available, you bring, or else you just leave it up. After this, you are scrubbing. Fold your sleeves above your elbow. Okay, not at the elbow level, high above your elbow. Okay. This picture is the WHO guidelines. WHO, World Health Organization guidelines. First he is washing the hand. He is just washing only the hand, this area. We are going to wash from the tip of the finger till the elbow. Okay, the whole hand we are just going to wash. And second, he is taking scrub solution, scrubbing solution. In this, we are going to use this particular scrubbing solution, but we are going to press here. He is just taking it from here with the fingers, but we are not going to do that. With your elbow, you are going to press. Once you take, you are going to apply nicely. All over, you just apply once. Then from picture 4, 1, 2, 3, you just leave. You just scrubbing and applying all. Okay. Forget out first 3. The stroke starts from number 1. Okay. Picture 4, number 4. Outer surface on both the hands, that is first. Second will be the inner surface, two hands together. Third one will be like this. Fourth one will be for the thumb. Okay, and fifth one will be for the palmar surface, inner surface on both the hands. Okay, 1, 2, 3, 4 and 5. After that, the sixth will be the wrist, to and fro, both the hands. And from the tip of this sixth, seventh one will be from the tip of the finger towards the elbow, towards your forearm, in one direction, no two-way, one direction, unidirection. Is it clear? So 1, 2, 3, 4, 5, then wrist, then the whole hand. Yes, I'll just show you. First, you're going to wet your hand completely. Okay. This hand should not come out. The water should be inside. I'll just wait for a few seconds, let all the water drip inside. Then you press once or twice. Not little, not more. Then after that, you just make a mild lather, apply all over. Clear? Now your stroke starts. Just for a few seconds. 10 to 15 seconds. This hand also 10 to 15 seconds. One is over. Second one will be inner surface. Nicely 10 to 15 seconds. Third one will be finger, inner surface of the finger. Then your thumb of one hand, the other hand. Okay. Then the inner surface. Each stroke will be for 10 to 15 seconds. Then your wrist. Then unidirectional from top to bottom. Everything should be over the spittoon, okay? Not outside. Everything. And after doing this, you just wash. Don't do like this. This should not happen, okay? Just wash like this. Even if soap solution is sticking, don't worry. Just wash it completely and the tip of the finger should not face like this. It should not wash like this and all. Okay? It should be facing upward. At any cost, it should be facing upward. Once you finish, let this drain inside. Let it not come out. Just don't take this. Just go for the other hand. See, for example, yeah, just see, soap is here. Don't try to rub with the other hand. Try to wash. Even if it is not going, don't worry, just leave it. This technique is for surgery, actually, major surgeries. But still we want to practice it here, okay? So just breathe for a few seconds, drip all the water. Then you take your tissues and wipe. Usually we have to use a sterile cloth. We don't have here. Okay? Take tissue, wipe. Then after that, wear your scrub. So can you just take the gown from the third one? Don't use this. We don't have tissues, so I'm just using this. Any soap solution, don't wash right now. See, here are soap solution. Okay, you just leave it. I'm just using it simultaneously for both the hands. Okay. Now the assistant will come and tie. Okay. I'll do one thing. You can take one more glove, one more gown. I'll do it. Now we wear this. At any cost, don't come in front of the patient and tie like this. Okay, you should go behind the doctor. Don't pull it from here. This should not start. Okay, from inside pull it out. At any cost, the front side should not be contaminated by you. Okay, and then tie this one. Morning, doctor. Do not take bath. So I'm taking bath here. Then from the side, this one, okay? And again from this side, the dentist should not touch. Tie. The necktie as well as the waist. Once you finish this, then you have to go for gloves. It's better to go for surgical gloves, at least for exam. Okay, that will be better. Just a minute. Don't do this, okay? You should not do all these things. Just to make it fast, I'm doing. Make sure everybody is having this picture. Okay, we have it. This is WHO guidelines. No problem. After you just strip this and drop it over there. Clear? All these papers should not come here. Pardon?
I said that we can use this.
Better. If Dr. Mukhtar is expecting, then okay. If you don't have this, go for examination gloves. Drop it. Either you can do this before, or by mistake if you're forgetting, you don't do this. Okay? You should not touch this. Your assistant will come and open. Even the instruments, if you have forgot, don't worry. Nothing wrong with it. Ask the assistant, you don't do it.
Can I open the instrument without gloves?
Pardon?
I open the instrument without gloves?
Yeah, without gloves. If you're wearing gloves, then you have to change the gloves. Yeah? Fine. Now, after displacing this, after dropping this, take it without touching any of the instruments. Open this fully, okay? It was like this, right and left, okay, for each hand. Hold it here, one inside, one outside. Keep your hand like this, slightly club it and take it up. Clear? Then this one, you should not touch it here, okay? You should hold it here. It is slightly difficult. Once you get into practice, it will come for you. I think it is slightly smaller for me. No problem. I made a mistake. It is the other way, okay? Not there, it is here. Clear? You understood? The gloves was like this, not from here, from here. Okay? From the upper pouch, get it in. Okay? I'm holding it here only. I'm not holding it like this. Okay? I'm holding it like this. You should not hold it like this. Like this, you pull it straight. After wearing both the gloves, then you adjust the fingers. Okay? Stretch all the fingers, because each and every finger is important. When you do surgery, you need to retract. If the gloves is loose like this, you cannot stretch the tissues inside. Stretch all the fingers. Make sure you're taking the correct size gloves, okay? Okay. This paper, either you throw or the assistant will throw, because this paper is sterile. It was inside, so this is sterile. After doing this, we have to arrange the instrument according to the Arabic or American style. Arabic, I'll tell you, okay? Mouth mirror, probe, tweezer. Okay? Don't give more space like this, and don't keep it very close like this. When you take the other instrument, your finger should not be disturbed. Okay? At least 1 inch or 1.5 inch between. Then your syringe. Then your other materials here. Okay? Whatever you keep it straight and neat. Here. Then take this. Better to take cotton pellets. The sister, they have small cotton pellets. You take that. If you not able to get, take from the inner side. Little loose it will be. This size is better. Okay, not bigger than this, not smaller than this. One for drying, one for applying topical. See, many students, first when you take, you are squeezing the cotton. By the time you arrange everything and come back, this will become loose and it will become slightly big. Just like that you are taking and using. If you take this, see how loose it is. Cotton is loose. You cannot dry the soft tissue, or you cannot apply. Whenever you take, each time you just compress it nicely, hold it tightly, so the looseness is less now, so you can dry nicely, you can apply topical nicely. And replacing the instrument should be in the same place, not upside down or not like this. It should be straight and neat. Okay, now we'll load the syringe. Hold the syringe over your palm like this. Keep your thumb, push it up. Okay, just pushing it up. Then the head of the cartridge should go first. Then leave it. Keep it here in the palmar surface. Push it up and give a rotation. 1, 2. That's all. Not continuously. Don't do that. 1, 2. That's all. Then after that,
the bar, hearing.
Next week exam. I'll show you. There is a picture I'll show you so that you can read it. Okay, anyway, I'll tell you what. Then it will be better. What area is this? What adapter? What you are going to adapt here? So this is needle adapter. Clear? This is body of barrel of the syringe. This is the finger ring. This is the thumb ring. What is this long structure called? Pistol. These two small sharp ones are called harpoons. Okay. In certain injection syringes, there are no rings. You will have only grip, finger grip. And in certain things, you don't have the thumb ring. Thumb rest you have. Okay, you just rest your thumb there and give the injection. It depends upon each syringe. Then comes the parts of the cartridge. What is this yellow color? Head. This yellow color alone, what material it is?
Metal.
Aluminum cap. Okay. The center one, rubber is there. What do you call? See, if I tell you now, you cannot remember. I'll give you the picture. That will be better, okay?
Continue, no problem.
Okay. So this is rubber diaphragm.
Diaphragm.
Below that,
Neck.
neck. This is the body. Clear? What is this one? One rubber inside. Rubber plunger. Okay, a rubber stopper. The whole amount has 1.8 ml. Everything is written here. No need to study. Okay, it's written here 1.8 ml. And what solution is it? Scandicane 2%. Scandicane is a trade name, but the chemical name is Mepivacane. Okay, it is 2%. The green one is 3%. If you take the green coded, it is 3%. Okay, then the batch number is written as well as the expiry date is written. Then if you take it vertical, here you have some graduations, okay? Horizontal graduations, okay? It is starting from top is 0.6, 0.9, 1.2, 1.5. Clear? Each segment is 0.3 ml. Okay, from the base to 1.5 is 0.3. From 1.5 to from base to 1.5 is 0.3. From 1.5 to 1.2 is 0.3. The same, each segment is 0.3 except the upper one. Upper one is starting from 0.6. So the upper one is 0.6 ml. Clear? The upper one is not divided into 2. It is 0.6. Fine. Then what else in this? That's all. Clear? We'll jump on to the color coding is here. The brown is for vasoconstrictor, green is for without vasoconstrictor. It is not a standardized one. Each company they differ. Clear? So don't see the color coding and go. Always see the pack, what is written, then go for it. Since we are using only these two, no problem here. If you go outside to US and other places, you have to see for the pack. Okay. Now we'll go for the needle. Here the thickness is given in gauge as well as in millimeters. It is 27 gauge or 0.4 millimeters. Okay, 27 gauge or 0.4 millimeters. That is the thickness, and the length is 21 millimeters. Okay, you just rotate it and pull it up. This will come. You just remove this also. See here it is written 21 millimeters. Clear? 21 millimeters. That is the working length from the tip of the needle till the hub. That is 21 millimeters. It is not from the tip of the needle here to the tip of the needle at the down. It is not. Only the working length is 21 millimeters. Okay, now we'll go for the parts. The tip here it is slightly angulated. That is beveled. Okay, so the bevel is there. What is this one called? Not body. Shank or shaft. Clear? Then what is this white one called? What you're going to adapt in this? Syringe. So syringe adapter. Okay. Here in the syringe it is needle adapter. In the needle it is syringe adapter. The name changes. Okay. Then the junction between the needle and the syringe adapter, you call it as hub. That is the weakest part. If it is going to fracture, it will fracture only in this area. Very rarely only in between. Right. Then the last end is the, it is going to penetrate the cartridge here. So it is cartridge penetrating end. Here you find a small triangle here, black color triangle. Okay. So this black color triangle corresponds to the bevel. Okay. Just imagine syringes like this. We are rotating like this. Now how we will know where the bevel is? By seeing the black. Okay. This means triangle is up. So now the bevel is facing up. Okay. You just see triangle is upward. If you see, the bevel is facing you. Can you see?
Yeah.
The triangle is here. If you see exactly here, the bevel will be facing you.
Yeah.
Wherever the triangle, the bevel is in that line. Clear? See, it is in the same straight line. Triangle is here, bevel is here. Okay, it is facing. Now we will see how to fix it. Here also we have many colors. Red we have, blue we have, green we have. Each one differs in size. This is a short needle. The green is 25 millimeters here what we have, and blue is 35 millimeters, I think. I'm not sure. 35. Can you take one blue? Long needle. See what? Yeah, it is 35 millimeters. Blue is 35 millimeters. It is the length alone, but the thickness is 27 gauge or 0.4 millimeters.
Nerve block.
Yeah, go with this for the nerve block. Especially not for all the nerve blocks, especially inferior alveolar nerve block and infraorbital nerve block. The rest, all other nerve blocks, use short. If you don't have short, don't worry, you can go with it. Nothing wrong. But for PSA, never go with the long needle. Posterior superior alveolar nerve, never go with this. Use only short needle to avoid hematoma. Fine. We'll just fix this. Push it up once and twice. That's all. Then we'll rotate this. Pull the lower cap. Fix it on. Okay. Give some mild pressure. Make sure it is straight and more than 3/4 of the thread should be completed. If it is not straight and slightly curved like this, don't use this. Okay, try to refix it. Keep rotating nicely. Yeah, then pull the cap straight, it will come. Many students here, I have noticed this, they used to open it single hand. While taking, you see the tip of the needle, it is touching. Clear? At any cost, you should never touch this, because the paper which we use here is not sterile. It's supposed to be sterile. All these instruments are sterile, but once you open and drop in this, the sterilization goes. Clear? Just to follow the principle, we are just doing. Now see, the needle is bent. Can you see? Even last week, one student was doing, the needle was bent. Clear? Fine. So never, I think it is you. You both came, no, that day? You, it is not you? Okay. Not only you, many students are doing this. Okay. So if it is the case, remove this and go for the another one. Don't use this. So whenever you remove or change anything, recap it and keep it safe. Okay, now I am going with the long needle. You just with two fingers or two hands, you just remove this. Either you keep it here or you keep it here. But in exam, you don't keep it here because Dr. Mukhtar wants you to practice scooping technique. But when you're practicing clinical, then you can do it. It is easy to close it. Okay, you can just press and you can remove and keep it down. But for exam, you just keep it like this. Yeah. Once you finish using, or for example, you have applied topical. Now you took the syringe, you're going to inject. In the meantime, you forgot something. You want to keep the saliva is there. You want to keep this for just for a second. Don't keep this and do the work. Scoop. Immediately, even if it is for 1 second, just scoop it. Okay? Scoop it. This will keep running like this. If it runs like this, take a tweezer, hold it like this. Okay? Then scooping should be pressed like this. Okay? One student while pressing, he was pressing the thumb like this. All the solution came down. Okay? Don't press the thumb area. Press only these two fingers. Okay? These two fingers you press down, or you keep your hand here and press like this. Okay? Right. One more thing is there. See, now you are going to inject into the patient mouth. While taking the syringe, don't keep your thumb in front of the ring, because if you keep slowly, this will keep dropping. See, now it is like this. Many students, they wipe it here or they wipe it here. sometimes the coat also. Okay. So this is, they think this is sterile. So and they will inject. So keep the thumb at the back of your ring. Even if it is there, don't do all these things. Okay. Keep it like this. Take into the mouth. After injecting, then you bring your thumb in front and inject. Aspirate and inject. Yeah. Fine. Now we'll go with the disposal of the instrument. See, at any cost, try to keep your table very clean. Right. Now we have finished. Injection is over. Okay. First, dispose the needle. That is very crucial. Always dispose the needle first. Remove this. Keep it straight. Take this. Be very careful. This you cannot do it scooping. If you want, you take this, hold it, and do it. Always follow the safety measures. If you are able to do it carefully, well and good. Or else, try it. Ask your assistant to do. They will do it. After taking these two syringes and the cartridge. Okay. Just keep this. Put a opposite side rotation. Okay, now see, it was like this. I am just using opposite direction rotation, then it will be unlocked from the rubber stopper. Then I am taking the cartridge and the two needles. Now I am going to drop into the small yellow dust. Try to put into that. Then after that, ask your assistant to remove this one. Okay. At any cost, you don't take this in hand with your glove. Okay. You just keep it one side. Ask your assistant to open. Okay. We are just interchanging the steps and doing. Okay. You just when you want to apply topical. Okay. Ask your assistant to. Can you just? Yeah. That's all. You don't do this because you will keep your finger inside the mouth. Again, if you touch this will be contaminated. The same thing you will use for the next patient. Okay. So ask your assistant to do it. Once you apply in the patient's mouth, throw into the. Most of the students, they will keep it here, or it will be sticking to the tweezer itself here. Okay, don't do that. Fine. Now once work is over, ask the assistant to remove this. Just hold this. Okay. Now cartridge is over. All the cottons, everything you throw into this. The metal instruments, you take it carefully and you have to throw over there. Then all these wastages, anything you throw, all the scope into the green basket. Then throw it into this. Then comes your gloves. Your gloves, you are not supposed to keep one finger inside and one finger outside as you are wearing. Wearing differs and degloving differs. Near the tip, but fully outside. Okay. Then slide it straight out. Then here, put your finger inside and straight out. Now it is free. After this, the assistant will remove at the back. He will not remove the knot. He will just tear and push it at the front. Then it is your responsibility. If it is not coming, don't worry. Put your hand inside. Okay, here. You don't remove like this. Put your hand inside a little and then it will come outside. Now turn it. All the inner surface, outer surface should go inside now. Okay. Then rotate it nicely. Throw into this mask, head cap. That's okay. Now everybody is passed. Exam over.